Have you ever caught a glimpse of yourself in the mirror and done a double take thinking, wait a minute, is my tongue yellow? Yeah, it can be a little jarring. Well, today we're going to break down exactly what that means.
It's a bit of an alarming moment, isn't it? You're just going about your day, you happen to glance in the mirror, and bam, you see a color you definitely were not expecting. If that's happened to you, trust me, you are not alone. And look, right off the bat, let's get to the most important point. A yellow tongue is almost always a temporary and harmless thing. It's really more of a signal than a serious problem. So let's dive into what it's trying to tell us. So here's our game plan. First, we'll talk about what this condition actually is. Then we'll look at the everyday things that cause it. After that, we'll go over a simple action plan. And finally, and this is important, we'll discuss when it might be time to actually see a doctor. All right, let's jump right in. Part 1, understanding what is really going on here. So what's actually happening? Well, think about the surface of your tongue. It's covered in all these tiny little bumps called papillae. Normally, your body sheds the old cells off these bumps all the time. But sometimes, those dead skin cells can kind of hang around and build up. And when that happens, they become these perfect little traps for bacteria and food particles. It's that buildup, that combination of stuff, that creates the yellow coating, not the tongue itself. Okay, so if it's just a buildup on the surface, what's causing it to happen in the first place? Let's take a look at some of the most common day-to-day culprits. You know, when you look at these, you can see it's surprisingly simple stuff. A lot of the time, it just comes down to basic oral hygiene. If you forget to clean your tongue, that buildup gets a chance to form. Dehydration is another huge one. Saliva is basically our mouth's natural rinse cycle, right? So if you don't have enough of it, bacteria can just multiply. And then, of course, you've got direct staining from things like smoking, coffee, or tea. Even some medications can cause dry mouth, which, you guessed it, reduces that helpful saliva flow. Okay, so we know what it is and what causes it. Now for the most important part. What can you actually do about it? Let's get into the simple steps to get things back to normal. And here's the good news. The fix is usually just as simple as the cause. Step 1 is the most direct attack. Gently brushing your tongue or using a tongue scraper will physically remove that layer of buildup. Next, just upping your water intake acts like a constant natural rinse for your mouth. From there, it's about avoiding things that add to the problem, like tobacco or those staining foods. And hey, maybe adding an antimicrobial mouthwash to the mix can help keep bacteria in check. And that really just hits the nail on the head, doesn't it? This isn't usually about needing some complicated medical treatment. It's all about simple, consistent habits. The small choices you make every single day are what make the biggest difference here. And to make sure it doesn't come back, just think of it as creating a healthier environment inside your mouth. Regular brushing and flossing, staying hydrated, eating well. It's the same advice you'd hear for your overall health, and it absolutely works here too. When you make these habits part of your routine, you make it way harder for that buildup to get a foothold in the first place. Okay, we've established this is usually no big deal. But, and this is an important but, it's always smart to know the exceptions to the rule. So let's talk about when you should get a professional opinion. This is probably the question that's been in the back of your mind this whole time. And the answer is, in rare cases, yes, it can be. So what are the signs that separate a simple hygiene issue from something that needs a doctor's attention? So here's the key distinction. Really, the biggest factor is time. A typical case should start clearing up within a week or two, once you improve your oral hygiene. But if it's sticking around longer than that, or if you start noticing other symptoms popping up alongside it, that's your cue to get it checked out. So these are the specific red flags to watch for. If that yellow color lasts more than 2 weeks, despite your best efforts, if your tongue is actually painful, or, and this one is very important, if you notice any yellowing in your skin or the whites of your eyes, that could be a sign of jaundice, which might point to liver issues. A fever is another big warning sign. These symptoms go way beyond simple oral hygiene and are definitely not something you should ignore. So, to wrap it all up, try to think of a yellow tongue less as a scary symptom and more like a helpful little reminder. It's usually just your body's way of tapping you on the shoulder and saying, hey, let's maybe pay a little more attention to brushing and hydration. And that leaves us with one final thought. Our bodies give us small signals all the time. Paying attention to something as simple as a change in your tongue color is a really great way to be proactive about your health. It kind of makes you wonder, what other little messages might your body be trying to send you? Thanks for tuning in.